Hi, Ron from Clarity. In this video, we're going to talk about scaling your HIPAA e-commerce without breaking compliance. We all know that websites are dynamic. They're constantly changing as our business grows, as marketing and sales and everybody else gets involved. Things change over time. So how do we ensure that as things change, we get away from the project after it's done and launched? How do we maintain that compliance? Here's 4 ideas to keep at the front of your mind. Number 1, segmenting the HIPAA workload from the standard operations. You have to change a mindset. We have many clients that come to us that have had a WordPress website for 15 years, and now all of a sudden they want to make it HIPAA compliant, and they don't want to pay to completely re-engineer the site, start from scratch, migrate the data over to a HIPAA environment. So a lot of times what we'll do is we'll spin up the HIPAA compliant portal on a different server, segment those away from each other, and then we will embed the HIPAA elements on the WordPress site using cores with a trusted relationship. So when they log in, they're logging into the secure portal. The problem with that, and what happens is if you don't have a mind shift, somebody comes along a year later and says, oh, we need to add a new intake form or a new patient consent form. And they go into Gravity Forms in WordPress and they add a form. And the next thing you know, they violate HIPAA because the form itself is grabbing data, taking in that data and storing it in the SQL database that's not HIPAA compliant, and they just violated the storage laws about PHI. So if you segment out the different functionality and think everything that I take in data has to be on the HIPAA platform, then instead of using Gravity Forms for doing an intake form, you use what we'll use on one of our modules, we'll call it action forms just for the sake of this example. We'll use action forms. So all medical forms use action forms, all sales forms use Gravity Forms, right? And that would be something. So segmenting all of the HIPAA stuff out so that anybody that touches anything that has anything to do with PHI or HIPAA has to go into that HIPAA environment and stay secure. Number 2, documenting every integration step for compliance. If you have an audit, if you have somebody leave the company and a new person come in, how do they know the process? If they're supposed to be the new HIPAA advisor or the security officer, how are they supposed to go in and audit? How are they supposed to know what's where and what processes are moving data and encrypting data and storing it where? So make sure to document every single step in your integration. We've done over 4,000 integrations in the last 20 years, and a lot of that is when we're integrating EMRs to doctor-patient portals and HIPAA compliance. So we've got online pharmacies pulling informations and medications and patient information. So when Ron gets a new prescription for naproxen, it can look up and see that he's also on oxy for knee surgery and say, oh, he can't have 2 narcotics subscribed at the same time. So, that type of information, document that, make sure that's well recorded. The next one, number 3, use multi-factor authentication across all your domains for any administrative access. Make it harder for people to hack, make it harder for data breaches. Theoretically, you've got everything in a HIPAA environment. It's all encrypted. You should be relatively good. But if somebody gets into the admin interface and opens it up and they can see all the data and then turn around and export all the data, that's also considered a breach. So use multi-factor authentication. Keep all your admin logins secure. And finally, ongoing performance of vulnerability scans. Check your code, check the servers, make sure the servers are updated. Make sure you've got a BAA in place. We covered that on the previous video. Have that business agreement in place with your hosting provider and your solution provider. Engage somebody else to do penetration testing and security testing. Change your passwords once a year. Just ensure that you're ongoing and diligent with your vulnerability and your testing. Quick reminder and summary of the 4 things. Segment out the HIPAA functionality to ensure that anything that touches PHI, anything that's done with regards to HIPAA, is done in a HIPAA compliant, secure way. Number 2, document all of the integration steps, both for compliance and auditing. But if you have a change in staff, somebody else can come in, see the solution, figure it all out, and understand what's going on in case you make a change. Number 3, multi-factor authentication across all admin logins for any area of the solution. And number 4, ongoing performance of penetration testing and vulnerability scans on both the code and your servers. Thanks for watching. We'll catch you in the next one.